Good morning, everyone, and welcome to the webinar. Today you're attending Physical Activity in Schools, Resources and Case Studies to Implement House Bill 1069, a webinar hosted by LiveWell, Colorado. Today's objectives are to develop an understanding of how House Bill 1069 can be implemented in different settings, highlight case studies of school districts that have successful physical activity programs, and connect to useful resources for increasing physical activity in schools. Our presenters today are Lisa Walvord with LiveWell, Colorado, Eric Larson with Denver Public Schools, Connie Fenton with Aurora Public Schools, Kathy Kopp with East Grand School District, Stephanie Wasserman from the Colorado Legacy Foundation, Kyle Legleiter with the Colorado Department of Public Health and Environment, Jessica Hinterberg with CanDo, and Ann Jensen with Healthy Kids Club. So with no further ado, I'd like to turn this over to Lisa Walvord.
So moving along to our content, just a quick reminder of what the physical activity bill is requiring. We did do an earlier webinar, so if you need more details on that, you can go to our website and hear the first webinar in more detail. But just a quick reminder that essentially the bill that was signed into law in April, that each school district, board of education, and institute charter school must adopt a physical activity policy that ensures that each elementary student's schedule meets a minimum number of minutes of physical activity, which is essentially 600 minutes per month for full-day students, which is an average of 30 minutes per day. And schools are required to adopt this policy during the 2011-2012 school year. So our timing is right on. The definition of physical activity in this bill is rather broad. It includes recess, physical education classes, fitness breaks, classroom activities that include physical activity, exercise programs, and field trips that include physical activity. One of the things that's been talked about previously is ideally schools are finding ways to fit specific 30 minutes into a schedule each day for students as opposed to just trying to find ways to pull together a total of 30 minutes. So that's something important to keep in mind. The next step for local schools is to align their school practices with the district policy for this coming school year, really to look at what's the amount of time that students have opportunities for physical activity in the current school schedules, and then increase the amount of time if necessary. And really, ideally, and for the best outcomes for our students, schools should go beyond the minimum requirements of this law, not just in terms of the amount of time, but also in the quality. And so you'll hear a lot of the focus from our speakers on the quality of programs that they are putting in place. So with that, I'm going to hand it over to Eric Larson, who's the Physical Education Coordinator for Denver Public Schools.
In July of 2009, Denver Public Schools received a Carol M. White PEP grant for our elementary physical education program. And through this funding, each of our 88 elementary schools received $7,000 worth of equipment. Also, professional development is a key for us and our teachers, and we offer 7 days of professional development, including the Physical Education and Dance Summer Institute. Now, the Summer Institute, we bring in the National Teachers of the Year in the area of elementary, middle, and high school physical education, adapted physical education, and dance. This is a 3-day workshop, and it's attended by not only DPS teachers, but teachers statewide. Our SPARK curriculum maximizes moderate to vigorous physical activity time, and it emphasizes activities that allow students to actively engage in moving and learning sport, dance, and fitness skills. And we really like the SPARK curriculum because the emphasis is on moving, it is on moderate to vigorous physical activity time. Our ratio is 1-to-1, 1 student for 1 piece of equipment. And as the students progress with their skills, then we do partner activities, and then 2-on-2 games, let's say for soccer, 3-on-3 soccer games. And that way our students are actively involved there's enough equipment for all the students, and they get a lot of touches. And the Spark curriculum, if you go on their website, they do offer free lesson plans, instructional videos, and assessment tools. One of the areas that we measure as part of the PEP grant is MVPA, and that's moderate to vigorous physical activity. Nationally, approximately 30 to 40% of physical education time is spent in MVPA. The recommended amount is 50%, so nationally we're below that amount. Now, moderate physical activity, an example of that is brisk walking, causing an increase in breathing and heart rate. And then vigorous activity, for an example, jogging and aerobic dance, causes a large increase in breathing and heart rates. Now, part of our evaluation for our PEP grant is that we have an external person come in and conduct a classroom or conduct classroom observations using the SOFIT protocol. And SOFIT measures the percentage of time students are engaged in MVPA during physical education class. And through the work of the external evaluator, we found that DPS students were engaged in MVPA an average of 64.5% of the time. So that exceeds the recommended levels. So for an example, a class that lasts for 45 minutes, our students in Denver Public Schools are active for about 30 of those 45 minutes, and they have high levels of MVPA. In conclusion, our goal in Denver Public Schools is to offer a quality physical education program so our students will develop an active, healthy lifestyle.
Great. Thank you very much, Eric. It's exciting to see what's happening at DPS. And as he mentioned, there are resources for that Spark curriculum that are available to anybody. Of course, it's nice to have the funding for the equipment, but there are some free materials that are out there for anyone to access. So that's great. And next, I want to introduce Connie Fenton, the Healthy Schools Coordinator for Aurora Public Schools. Connie?
Hi. We have a new project that will be starting in September. We just received a grant from the Legacy Foundation, and it's called the 3R Project, Relevancy, Rigor, and the Relationship of Physical Activity. It has been shown that we have a great need to help the staff and the teachers increase physical activity in the classroom. We're targeting the elementary levels. Research has shown that successful schools provide rigorous academic coursework, relevant learning opportunities, and meaningful relationships with instructors. And we know from the research that if we increase the activity of the brain by increasing activity in the classroom, that they're able to engage in this the 3 R's more easily. So we have decided to do it a 3-tiered project. We're calling, teachers have to apply for, next slide please. Teachers have to apply for an application, with an application. They have to get their principal to sign off. We're going to use the train-the-trainer model in some aspect. They come in for a 6-hour training. We have our own very professional in-house trainer, Chris Strader, that's going to be doing the professional development training, along with Kim Bevel. This is on September 13th, so we're still in the planning phases of our program. They're going to be using resources from JAM, from Alliance for Healthy Generation. And the key thing here is that they have to get a principal buy-in, because once they've gone through our training, they need to go back to their school and do 3 15-minute trainings in their schools by the end of February. We're hoping that by providing this opportunity, our goal would be by the end of the year that we'll have half of the classes doing some kind of physical activity in our elementary levels. And as of last night, we know that we also have a big need in our middle and our high schools, because we have had some things about middle and high school just happened in the last year at APS. So we're going to be working on thinking about looking at those also. So as in closure, the 3 R's stand for the relevancy, rigor, and relationship. And by having a student ready, by increasing his physical activity, we hope that they're better able to engage in the 3 R's. Thank you.
Great. Thank you very much, Connie. And again, Connie mentioned some resources with GM and Alliance for a Healthier Generation, and we will have those available, links to those for all of you. And it's exciting to see things happening. Some of this is kind of midstream, but we're hopeful that the bill kind of reinforces it, and the point that Connie made as well, there's need in middle school and high school. So those of you who have the opportunity to bring this beyond just elementary school, we strongly encourage that. Next up, we have Kathy Kopp, who is the District Health Coordinator for East Grand School District. Kathy.
Good morning. Just a little bit about East Grand. We are kind of the one of the smaller districts in the state that have fortunately been provided money through the Legacy Foundation and CDE for a few years now. And we feel that we've done a lot of great things with this. And our focus, as you can see in the slide, this year we have health teams in each school, and each of our health teams are looking at ways to increase physical activity beyond what is, of course, given through our PE programs. Through structured recess, our health teams are using music and movement in the classrooms. We're providing staff with opportunities to increase physical activity, and we really are honed in on the before, during, and after school opportunities for our students, because a lot of them are arriving at our elementary schools and middle school sometimes 45 minutes before the bell. So instead of just kind of hanging out in the commons area, we decided we need to work with them in the gyms to get them active. So as you can see up there on the slide, we have themes, and we call Amp It Up, Move It in March, and one of our health teams did a mile a day in May. So next slide, please. So I'll focus on the recess. Our health teams looked at where are our kids gathered all together at a consistent rate, and we have, most of our elementary schools have 2 opportunities in the day, morning and afternoon recess. So what we decided to do is, especially at the older levels, we saw a lot of kids just kind of hanging out on the playground and not really doing things. So we tried to give our teachers tools to increase their activity through more PE equipment. We trained a couple kids to be kind of team leaders, and so they organize on a daily basis those things that you see on the screen, relay races. There were some activities to get them active, jogging around the track, earning points for their classrooms. And of course, those elementary boys love the structured game kind of activities, football, basketball, and tetherball. So what we saw is that these kids are more active during this time, and when at 2 of our schools, when one of the principals wanted to take recess away, the teachers talked them into not removing recess of the afternoon because these kids are active, and when they came back into schools, they totally were focused on academics. Next slide, please. The other component that we've done that has been very successful is that we have introduced music as a way to increase movement in the classroom. So our school health teams on a weekly basis provide staff with Jam and Minute. Our PE teachers are awesome as far as teaching staff routines to incorporate in their classrooms, such as the Thriller. And we have provided some of our classrooms with fitballs and mini tramps so that they can incorporate movement when they see needed. And I put the special ed classes are doing 15 minutes in the morning and 15 minutes in the afternoon as far as break times for their students. And other classroom teachers, they'll have their fitballs, and when they see students kind of needing activity, they'll allow them, after they do their work, to go to this activity center and do whatever they need to do. Music has been awesome with staff as a way to transition their classrooms, and many of our students or teachers are incorporating music to enhance the literacy programs or the math, using them to teach concepts, etc. So music has been a huge piece at East Grand. And the last slide, I think, next slide please, is that we have had student and staff fitness challenges incorporated in our year for a number of years. And so our biggest kind of hit is our student and staff spring tune-up. And if anybody is interested in that information, they can email me. Our District Health Advisory Council and our school health teams meet on a monthly basis, and we have established themes. And some of the themes, you know, as I said, is Amp It Up in April, and we do things. We have Climb the Grand Peaks, and we have weekly challenges that we post over our internet system, our district internet system, that challenges the staff to take part in activities. And then at our middle school, our PE teacher really works hard with all the reading specialists to incorporate fitness and movement in their literacy program in reading. So in conclusion, we are fortunate. We're doing a lot. Again, as was stated at the beginning, you know, we want to go beyond our PE programs because we see that there is a need to provide these opportunities for everybody to partake, and we have a healthier school district. So thank you.
Thank you, Kathy. That was great. I think you provide some great examples and success stories that I'm hopeful that others at different school and district levels can take away. And again, we will make sure that we get links to some of those resources. Another thing to highlight in Kathy's comments is the importance of teachers as advocates, and as they start to see the benefits of their kids being physically active, to engage them and making sure that the principals and the district level are attuned to that and providing that opportunity. And lastly, I commend you for including staff both for their own health and to serve as role models. And with that, I'm going to turn it over to Kyle Legleiter, who is going to give us all an opportunity to walk our talk.
Great. Thank you, Lisa, and thank you all for joining us this morning. One of the points that I like to make whenever I'm talking about physical activity in schools, and I think the comments from some of our colleagues in the field already highlighted this, is that physical activity during a school day is great for kids' health, but also for their memory, their learning, and their behavior as well. So it's, I think, great to model as adults what we're preaching, and also practice that ourselves, because as Lisa mentioned, we are role models for the children that we see every day as well. But another point to make about physical activity is it's also a great way to incorporate academic lessons and actual learning into physical activity time that you're providing during school day. So to that end, we're going to do a little bit of math this morning for the physical activity break that I have planned for you. We have a number of people here in the room with me broadcasting this webinar, and I'm going to guess what I think their favorite sport is, and then we're going to act it out and do a little bit of math along with it. So across the table from me, I have Shannon, who I am guessing loves basketball. So Shannon is going to jump up and do 3 basketball jump shots, and everyone is going to join her and do 3 basketball jump shots. 1, 2, 3. Now, Lisa on the other side of the room just dared Shannon to do 2 more basketball jump shots, but 3. So how many basketball jump shots is Shannon going to do? Let's act it out.
1, 2, 3, 4, 5.
All right, very good. You can add. So over to my left, we have Eric, who I'm guessing loves to play soccer. So Eric wants to do 2 big soccer kicks. 1, 2. Now, he just hit the person next to him, so on the big one. So this time he's going to do 1 less than 2 soccer kicks. So let's do that again. 1. Okay, we can subtract, 2. Okay, last one. My favorite sport is hockey, so now we're going to do some slap shots. I want to do 5 slap shots. 1, 2, 3, 4, 5. Okay, but I really love hockey, so we're going to go ahead and do 3 more. So we're doing 5 plus 3. 1, 2, 3, 4, 5, 6, 7, 8. All right, so we had some great physical activities, some good laughs, and then also a little bit of math. So thank you for doing that, and I'll hand it over to you.
Great. Thank you so much, Kyle. There's lots of examples online for activity breaks like that you can take, and you can also get really creative and do them yourself. And with that, I want to introduce Stephanie Wasserman, who's going to talk more about some of the resources. Stephanie is the Health and Wellness Program Director for the Colorado Legacy Foundation.
Thank you. So for those of you who are unfamiliar with the Colorado Legacy Foundation, we are an independent 501c3 that serves as a critical friend and partner to the Colorado Department of Education. We believe that every school should have an effective leader, every classroom should have an effective teacher, and every child should be healthy and ready to learn. The way we support Colorado schools and districts is by identifying promising practices, investing in innovative work, recommending policy, evaluating results, and importantly, sharing our findings with all Colorado school districts and schools. So one resource that we have available to schools and districts is our best practices guide in health and wellness. And you can access this comprehensive guide on our website at colegacy.org. This page just gives an example of what you would, some of the information you would find under our physical activity page. For example, a best practice is to use the brand new updated physical education standards to create a comprehensive physical activity program that integrates physical activity throughout every school day. For example, you could get students moving during reading and math, or you could establish an annual district-wide bike or walk to school day event. And just as an aside, October 5th is National Walk to School Day. So at the end of the website, you'll be able to see a link for resources on things that you can do to support National Walk to School Day. You also, it's a best practice to develop a board policy to provide more opportunities for students to engage in physical activities. With the passage of 1069, this is a great opportunity not just to look at that particular policy, but more broadly at what your school wellness policy says. There are more ideas on best practices on our physical activity resource page. Another way that we support schools and districts is through the assisting them with tools and resources in the adoption and implementation of the brand new comprehensive health and updated physical education standards. So again, on our website, there is a whole host of resources around helping to promote it as well as to teach these new standards. An example of some online promotional tools that are available on our website are talking points that can help educators introduce Colorado's new comprehensive health and physical education standards to parents and students. some ideas for you to reflect on with your community are ways highlighting training opportunities and instructional resources that are available. And in a minute, I'll talk about some training opportunities available through the Colorado Department of Education. You could also cite data from your community, such as rates of heart disease or teen drug use. And finally, you could reference your school-specific health and wellness efforts, such as other types of frameworks around coordinated school health, positive behavior interventions and supports, and other healthy school initiatives. Upcoming opportunity for professional development. It would be great to mark your calendars now for April 4th, 2012. It seems like it's far away, but actually it'll be here sooner than we think. This will be our full-day Healthy Schools statewide summit that will bring together local and national experts addressing all different information sharing and professional training opportunities for healthy school districts. Also, so please visit our website in the upcoming weeks for more information on that. Also, we are developing a full calendar of professional development opportunities to support the 14 school districts that are currently funded with our innovation grants, but also some of the TA and professional learning opportunity will be available for other school districts. In terms of potential funding, as you learned on this website, East Grand, and we're so pleased to be able to support East Grand School District as well as Aurora Public School District in their efforts around supporting healthy school strategies. We currently fund 14 school districts across the state, and annually we offer a competitive grant opportunity. So please stay tuned for the next round of competitive grants that will be offered in the spring of 2012. The guidance and applications will be available on our website. Also, some other ways for you to access funding. The Colorado Health Foundation has quarterly opportunities for you to apply for physical education quality improvement grants, active play area grants. So the next quarterly deadline is coming up October 15th. They've been wonderfully supportive of school districts in their efforts to expand healthy opportunities for students. Finally, as we learned from Eric about the Carol M. White Physical Education Program, these PEP grants it's an annual process, competitive process that will be available again this spring. So stay tuned for announcements of this through the CDE's website.
Great, thank you so much.
Oh, I also just quickly wanted to mention the Colorado Department of Education offers physical education workshops, a whole workshop series that is run by Terry Jones. And these are advertised through the CDE website, as well as the rest of us will be posting dates for that. They're an opportunity for a cadre of physical education trainers to offer training opportunities around the state that include learning more about the standards, fitness assessment tools, using technology, and incorporating physical activity into school day. So stay tuned for those opportunities that will be posted throughout the year.
Great, thanks, Stephanie. I'm not going to interrupt you again. You've got so much stuff to share with everybody. No, we really appreciate it, both from all the things that the Colorado Legacy Foundation does, not just from a financial perspective, but the engagement with grantees and the resources that you make available to everybody, and working with organizations like my own when we're trying to deal with some of the policy issues. So thank you for that. Next up, we have Ann Jensen, who is the Education Coordinator for Healthy Kids Club, and is going to talk about some of the resources that they have.
Good morning. I want to start by just telling you a little bit about Healthy Kids Club. We're a community health program. We're sponsored by Poudre Valley Health System, and we're based in Fort Collins. And we've been working on school wellness efforts and working with school wellness teams since 1998 to provide physical activity programs as well as standards-based health education. So this first slide shows you just a snapshot of the resources that we've developed over the years. And our goal is always to make it easy for classroom teachers to incorporate health and physical activity into their classrooms. So we started by developing a poster series, and Those are pictured on the left side of your screen. There are 8 posters, and they feature health topics such as breakfast, sleep, screen time. And then with the posters comes a book of talking points and also take-home challenges so that teachers can send those home with kids and get families involved in making health changes at home. Next slide, please. All right, one of the first resources that we developed are our Kids on the Move activity decks, and these feature over 60 10-minute activity breaks. The decks come with a music CD, and they're designed to make it easy for teachers, paraprofessionals, even substitute teachers, or even classroom volunteers, parents. They're real simple. Just flip them open. They give you the directions you put on the CD and give your kids or your students 10 minutes of activity break during the school day. Next. This spring, we developed something called Minds in Motion Fit Sticks, and this was in response to schools' requests for something just quick and easy, something they didn't have to read through the directions. So this is really simple. They don't require any setup or any preparation. As you can see, it's just a simple cup with some popsicle sticks, and on each one it gives activities. So students can pull these out of the cup, teachers can pull them out, and it gives you just a real quick energizer for during your day. You can also use them for staff meetings. It's a great way to get staff up and moving as well. One of our partner schools that we work with was recently awarded the Healthier U.S. School Challenge Gold Award of Distinction. And in an effort to meet the awards criteria, they wanted to implement sequential health education at every grade level. So we developed monthly health breaks. And although these are based on the new health standards, they were really meant as just a stepping stone for teachers to begin implementing health education. So they were more general than the new health standards will be, but we had lower elementary talking points, and then we had upper elementary talking points. And so teachers would get these emailed to them on a monthly basis, and it would give them a starting point for health education. We're currently working on developing health curriculum grades K through 5 that will be comprehensive. So this was just a beginning step toward that. Because we know that when kids are more comfortable with a subject, they're more likely to try new things, we compiled a booklet that sorted AR book lists and their titles according to physical activity topics. And so this has been beneficial for teachers when they're looking for books for their kids to read, when they're looking for books to fill their classroom libraries with. These, if you look in this booklet, it lists all of the nutrition-related topics as well as physical activity-related topics. Kids can be reading those kinds of things as well as learning about them. Next slide, please. We recently developed our Minds in Motion Math and Literacy decks. These decks are a group of cards that link concepts that are already being taught in both math and literacy to physical activity concepts. So for example, if you're teaching rhyming, or maybe you're reteaching rhyming, you can flip to the rhyming tab, and then this card will instruct you how to teach rhyming while getting your kids moving. So in contrast to our decks that are 10-minute activities just to get kids moving, which is, we also know is great, this actually links concepts that teachers are already teaching, because we hear a lot from teachers that, you know, they don't have a lot of time to add new things to their day. So this incorporates what they're already doing with physical activity. And now I'm going to turn it over to Jessica from CanDo.
Thank you, Ann. Next slide. So I'm Jessica Hinterberg, and I work for CanDo, which is the Coalition for Activity and Nutrition to Defeat Obesity. We are also a program that is part of Poudre Valley Health System, and we have LiveWell Colorado grant funding to work in 2 northern Colorado school districts. We work with Poudre School District in Fort Collins area, and then Thompson School District in Loveland. And so I just wanted to comment, building on some of the Healthy Kids Club resources, we also partnered with Healthy Kids Club to put together a school wellness resource kit, and that kit is fully available online. It's a PDF file where you can download any of the handouts,
And it does include, it's mostly a best practice resource guide for school wellness. And there is a downloadable PDF, it's page C5, that is a great handout called Active Classrooms Rock. It really demonstrates the why for physical activity, but also lists additional classroom resources and tools for physical activity. So it's a great handout if you're presenting to a staff meeting or talking with teachers, that this is just a quick one-pager that you can hand them, gives them some resources, and also demonstrates the why. Next slide. I wanted to finish up by talking about working with schools to integrate physical activity. Once we knew that House Bill 1069 had passed, we really wanted to work with our administrators and gain awareness and buy-in for promoting physical activity during the school day. And so one thing that we started with in Poudre School District was really focusing on presenting at principals meetings. We were able to get on the agenda usually for about 10 to 15 minutes and use some of the resources for physical activity breaks that Healthy Kids Club had developed. And they really enjoyed. We went through and modeled the breaks, talked about wellness, physical activity breaks as part of our presentation, and our principals really enjoyed it. They enjoyed the resources, wanted to take them right back to their teachers at their schools. But we also wanted to find ways to really promote physical activity and school wellness across the whole district. So anytime there are staff meetings or staff development opportunities with counselors, PTOs, BPAs, we really wanted to try and continue to spread that message of how physical activity is an important part of the school day. And so any opportunity that we get, we go in and try and do physical activity breaks and trainings on the importance and the need for physical activity breaks. And so I really stress that kind of looking at kind of creative ways of how you can really integrate physical activity throughout the day and with different stakeholders. And then finally, I wanted to finish off by talking about engaging parent advocates. We can engage parents throughout the school day as volunteers, whether it's helping out promoting active recess or before or after school activity programs, working with room parents who are planning any classroom activities or parties to really help kind of promote healthy nutrition, but also physical activity during the day. We also have parents serving on wellness teams in both districts, and we really see that parents can be great advocates for asking about how physical activity is integrated, how frequently teachers are doing classroom breaks, and really be a voice to work with school boards, principals, administrators, and teachers to really build awareness that physical activity is a priority in our districts. And so we do see parents as having a strong voice and helping support and making that happen. Thank you.
Great. Thank you, Jessica and Ann. Those are some incredible resources that you guys have developed, and they are broadly available. And so I'll put a plug for teachers and staff to ask your PTA or PTO to consider buying them for your schools. And even parents, I think I'm going to go buy them for all my kids' teachers for a back-to-school gift. So something just to consider is ways in which that no matter what role you're playing, ways in which you can help bring some of these resources into your school. Our last slide before we move into Q&A just highlights some additional resources. A few of these have been talked about. Again, we will be providing direct links to these and the URL so that you can quickly get to them. The first is there's an FAQ sheet regarding the HB11-1069 specifically. That is the physical activity bill. Another great resource is the National Association of Sport and Physical Education. You can find an extensive list of programs and resources that can assist schools in implementing a wide range of types of physical activity. The JAM School program brings, I think that was mentioned by a couple folks, brings physical activity and health education into the classroom, and it's a free resource for schools as well, designed to teach kids healthier lifestyle habits. The LiveWell Colorado Toolbox provides I think links to all of these different resources and a handful of others that we have accumulated through our partnerships. And then to find out how healthy your school is and even win the small grants for it through funding from the Colorado Health Foundation, the Colorado Department of Education, CDPHE, and the Center for Research Strategies, CDE has developed an assessment of best practices in the 8 areas of coordinated school health, including PE and physical activity. And finally, as we've just heard, we've got the CanDo resources, and then We Can is resources from the National Institutes of Health. We've got Walk to School Day on October 5th, which provides a great opportunity for some of that parent engagement and advocacy opportunities that have been talked about. And then the last that we've got listed is the Alliance for a Healthier Generation, which has a number of free resources as well as more information on grants that are available from a wide range of organizations around the country. So with that, I'm going to hand it back to Shannon, who is going to work us through some questions.
Great, thank you so much, Lisa. And we actually have a few questions already. Before we get to them, I just wanted to remind everyone to ask a question, just go ahead and type it into the question pane on your screen. And if your question is for a specific presenter, please go ahead and denote that when you're asking. So our first question is, can Kathy please elaborate on the fitness and literacy challenge?
The middle school PE teacher knew that there is an everyday reading class required at the middle school. And so she and these reading teachers and the reading specialists came up with a, it's kind of like a Candyland kind of board game. And so each day these kids spin the dice and it lands on a square, and then they in turn have to execute what the square has. So it was different components of physical activity. It might be something that they do at home with their parents. It might be a reading component, which would have them, again, it was more of a at home or during the reading class. So she did that a month with the reading teachers, and it was really successful. The kids loved it. And then at the end, there was an incentive for kids to complete the Candyland. So a combination of that and like chutes and ladders kind of thing. So it was a board game.
Great, thank you so much, Kathy.
Okay.
Our next question is for CanDo. How does CanDo recruit parents as advocates and keep them engaged?
I would say when I go out to schools and meet with wellness teams, I've always encouraged them to find sort of 1 or 2 parent reps that are willing to be on their wellness team. So I frequently will see them at wellness team meetings. But then we've also taken those parents who are interested in wellness, whether it's at the school level or district level. We do have a database of all their contact information, so we send them any sort of opportunities that exist that are going on, whether it's to speak to the school board or advocate for more PE at their school site, or kind of give them a heads up of things going on. And so at the site level, at the school level, we kind of engage with the wellness teams, but then also with the district's Physical Fitness and Nutrition Advisory Council, which is their student wellness committee. We also have parents that are interested in serving in that capacity on that committee, and we engage with them as well and keep them in the loop on things happening. But any opportunity, whether it's a health fair out at a school, back to school night, community events, I feel like every opportunity that you're interacting with your community, there's parents out there, and to really say, oh yes, we do school wellness, and many times they are interested in some capacity, whether it's nutrition, physical activity, PE. I think we end up finding parents that way as well.
Wonderful, thank you so much. Questions are rolling in, so I'll ask the next one. How does House Bill 11-1069 affect high schools specifically, since oftentimes students are only required to take a couple of semesters of PE and recess isn't around anymore?
This is Stephanie Wasserman with a response. So House Bill 1069 just focuses on elementary schools, so it doesn't specifically address physical education in the high school setting, but it does not preclude you from using this as an opportunity to look at your physical education policies in your high school and think of strategies that could improve both the time and quality of physical education in your high schools.
Wonderful, thank you. Our next question is, does recess have to have directed activities or student movement to fulfill requirements of the law?
So the law actually has suggestions around how you could fulfill the requirements of the law, but it doesn't specifically mandate the activity. So it gives lots of different broad definitions of what physical activity is. There is a recommendation that the school board maybe develop some policies around how you might be accountable for those minutes, as well as provide some recommendations for the State Board of Education to see how these could be measured in some kind of performance reporting. But there's a lot of broad ways that you could implement this without without mandating specific activities.
Great, thank you so much, Stephanie. Our next question is for Anne. What does AR stand for in your book, Integrating Health and Literacy?
It stands for Accelerated Reader, and it's a program that a lot of the school districts in this northern Colorado area use to assess what level of reading their students are at. And so it's a program that is already in the schools. And so we've taken that list of books and then just connected it to physical activity or nutrition topics.
Wonderful, thank you. Our next question is about the Healthy Kids Club resources. Can districts purchase the Healthy Kids Club resources, such as the activity desk or the Kids in Motion Fit Sticks? If so, how?
Yes, you can. The link is on here. I don't know if we need to go back to it or if they'll have access to it later, but it's on the page with our Healthy Kids Club contact information. There's a link for the order form on there as well.
Great, and we will be including those links in an email following the webinar that you all should receive later today. Our next question is about the SPARK curriculum. Is the SPARK curriculum implemented in every DCS school?
Yes, this was a 3-year process, and we're in the 3rd year. And so the first 2 years, we implemented the SPARK curriculum in 29 schools year 1, 29 schools in year 2, and we are now finishing up with our last 30 schools this year. So we're in phase 3 of the SPARK curriculum implementation.
Wonderful, thank you so much. Next question is directed to APS. At APS, how will you be tracking the increase in physical activity in the classroom?
Very good question. Since we're still in the planning process, we haven't come up with a plan for that actually. The training will be monitored by a lesson plan and then a sign-up sheet, and then we'll have to come up with a system to monitor.
Wonderful. And it looks like we have one more question, which is, Kathy or Connie, can you explain Jammin' Minute?
Oh, Jammin' Minute. Kathy, do you want to talk about it?
It's a program that is, anybody can sign up for it, and it's a great resource. It gives the classroom teachers a box that has just a few simple movement activities that is done in sequence, such as, jumping jacks, etc. And then along with that, so that the teachers can look at this, put on whatever music they want to do, and they don't have to think about what to do with the music. They just do what is provided for them. And then the other component that this gives is a school newsletter, a healthy news tips. And I also send those to all of our teachers because it's a tool that they can send home, take it off the computer, bring it to the classroom, give it to kids to take home to incorporate physical activity and nutrition tips at home. So it's a great, great resource, and it's free.
And once the teachers sign up for it, it comes to them on a weekly basis, and it gives them really great ideas on a weekly basis. Another resource that hasn't been talked about that we're looking at is Take 5, and that's a purchased resource that actually was created in Colorado, and so that's another very great resource. But it is 5 per classroom. So.
Wonderful, and thank you all so much for the great questions. I'm going to hand it back over to Lisa Walford now to finish the lesson today.